Hi, I'm Ashley Kenealy, and I'm a student at UNCG in the Public Health Program, and this is my Healthy People 2020 Objective Speech. The Healthy People 2020 Objectives are created in an effort to improve the population's overall health status. There are several categories concerning different focus areas aimed at achieving optimal health. Oral health is just one of the many focus areas and has been for a long time. There are 17 oral health objectives in the Healthy People 2020, with the main goals being to prevent oral and craniofacial diseases, conditions, and injuries by improving access to dental care and preventative services. Improvements are needed in several areas and may be achieved by increasing the awareness of how closely oral health and overall health are related. Possible changes in health care due to the health care reform may help to make dental care more affordable to those in need. The use of mass media and the formation of several community outreach centers have also been an asset by helping to inform the public about the importance of having a healthy mouth. Hopefully these efforts will improve not only the population's oral health, but their overall health as well. The World Health Organization has been creating health objectives since 1979 in an effort to improve public health. The first set of objectives have 15 priority areas, and the most recent Healthy People 2020 has over 600 objectives in 42 different topic areas, designed to serve as an outline for improving the health of all the people in the United States. The focus in 2000 was on clinical care. In 2010, the priority was to recognize the individual as part of the community. And the Healthy People 2020 objective plans to address societal influences on health. The goal is to reduce health disparities by focusing on the social determinants of health, including socioeconomic status, public safety, availability of resources to meet daily needs, education, job opportunities, and exposure to mass media. Even though several improvements have been made in the United States, the country still only ranks 37 out of 191 countries due to several areas of concern that still exist. Needless to say, there's still a lot of work to be done. Oral health has been a focus since the very beginning of the health objectives, with the first one being fluoridation and dental health. Now there are 17 oral health objectives in the Healthy People 2020, and they involve 33 separate measures. The main goals for oral health are to prevent oral and craniofacial diseases and the conditions and injuries by improving access to dental care and preventative services. Poor oral health can be caused by a number of factors, including limited oral health literacy among the population, inadequate dental care, little emphasis on oral health by primary caregivers, and most importantly, limited access to dental care due to the lack of dental insurance coverage. Of course, the individual can have the biggest impact on their oral health. Unhealthy behaviors such as tobacco use, excessive alcohol use, and poor dietary habits all lead to poor oral hygiene and overall dental health. Cost, fear, and the availability of dental care can also limit one's chances of improving or maintaining their oral health. People with mental disabilities or other chronic conditions also tend to have poor oral health. A low socioeconomic status, low level of education, and even some ethnic groups are contributing factors in poor oral conditions. Activities need to be implemented and evaluated to help impact health behaviors. Interventions such as the use of dental sealants and fluoride need to be used to reduce the level of dental decay in the population. Methods used to monitor oral diseases need to be improved, and the capacity of the state dental health programs to provide preventative treatment needs to increase. The number of available community health centers with an oral component also need to increase. In 2009, there were about 50 million Americans without health insurance, while millions of others had inadequate coverage for their health care needs. Private coverage was too high and public insurance was scarce. Healthcare reformers began to recognize and improve the healthcare delivery system by focusing on more primary and preventative care, creating incentives for the provision of higher quality care, and developing a system where healthcare providers work together to improve the population's health. The U.S. Patent Protection and the Affordable Care Act was put into place in March 2010, and its goal was to reduce the number of uninsured by more than 30 million, to slow the rising cost of the nation's health care bill, to reorganize the health care delivery system, and to improve the quality of care provided to all. The law will bring the percentage of the U.S. population without health insurance from 17% down to 5%. The PPACA is expected to help those in need achieve greater access to dental care. In over half the states, Medicaid does not cover dental insurance for adults, and even if it does, the payments to dentists are so low that access is inadequate for the covered beneficiaries. This, of course, is leading to poor oral health for several individuals simply because they cannot afford the dental care that they need. However, the new laws in Medicaid and Children's Health Insurance Program payments and Access Commission will be required to review the adequacy of Medicaid payments to dentists. The oral health community is also debating over the services that a dentist should provide. The scope of the dental practice could expand greatly if oral health care providers perform tasks such as checking blood pressure, diagnosing sleep apnea, identifying risky skin lesions, and screening for osteoporosis and cardiovascular disease. They could also intervene at the public health level by promoting smoking cessation and discouraging other unhealthy behaviors. Once dentists begin to perform these tasks, they may eventually become an important part of primary care and public health workforces and hopefully increase insurance coverage for those who have been without. As of now, 80% of dentists are general dentists and 70% of adults see a dentist once a year, so it would be an easy transition for them to become part of primary care. Dental hygienists may also eventually be able to practice independently and treat basic dental caries. Dental assistants may be allowed to start providing prophylaxis treatment. There's also a chance that there could be a more mid-level provider called a dental therapist who are already practicing in Alaska and Minnesota and are trained to provide some of the services a dentist and a dental hygienist perform now. All of these changes could possibly make dental care more affordable, and in turn, patients would have greater access to care. The ongoing changes in Medicaid and Medicare will not only increase oral health coverage, but also promote more preventative services instead of treatment-based services. By integrating oral health into basic primary services, the overlooked third of the population could become more educated about the importance of oral health. Those individuals or communities who are poor, isolated geographically, institutionalized, or medically compromised would benefit greatly from new practice models that accommodate their needs for prevention, maintenance, and treatment. Using community-based institutions such as schools, churches, and community centers could also serve as educational and access to care points to help integrate routine oral health care into a community. Not only would this provide more access to care, but there would be more potential for cultural competence and aware of the local community's needs. These strategies could help create an outlet for oral health monitoring implemented alongside new technologies geared towards self-care and alternative providers. Once the community has a heightened awareness of the oral health, it's being monitored and receiving routine care, the system should shift to more preventative-based care. Several community health programs have already been put into place. Schools are playing the biggest part so far. They are able to provide health education on oral disease and risk factors, as well as promote nutrition, safety, smoking cessation, and the use of mouth guards and headgear to prevent injuries during sport activities. Schools can ensure access and referrals to dental health care services and have dental hygienists deliver fluoride treatments and place sealants. Healthy, nutritious foods that prevent the risk of tooth decay are provided at educational facilities, as well as nutritional education concerning choosing healthy foods and beverages. Junk foods in vending machines and selling candy for fundraisers can be eliminated in an effort to improve the oral health status of the students. The counseling department in schools can ensure students with self-esteem issues due to poor oral health receive the care that they need. Good examples can be set by the staff. Parents can attend workshops to promote good oral care at home, and schools can engage community services to better meet the needs of the students. Clinical dental hygienists can also work in a collaboration with mass media to help educate the patients who have access to dental care to help improve the community dental health. Millions of Americans use the internet, television, and press to look for answers to health care problems. In fact, it is estimated that 59% of the population has looked for information online about a health condition or treatment. Even though healthcare providers are patients' first choice for obtaining information, technology is changing the education levels of consumers. There must be a shared decision-making system between the healthcare provider and the patient, due to the rapidly advancing amount of consumer health information available on the web and other media. It is very important to remind the patients that the internet has no government regulations controlling most of its content. Credible sources may be hard to distinguish from less credible sources for a patient, and that is where the healthcare provider comes in. 70% of individuals who use the internet says it empowers them to make better choices about their lives, while only 39% of healthcare professionals see the internet as a valuable source for health information. A professional must use their evidence-based decision-making skills to help the clients determine if the information is accurate or not. It may be very helpful to provide the patient with a list of credible websites that will provide them with useful, correct information and encourage them to find duplicate information from at least 3 sources before they assume it's true. As a professional, it is very important not to be dismissive or belittle comments made by people on the internet or refuse to accept information from the internet that patients have questions about. It is best to do some professional research in a credible journal to be able to guide the patient in the right direction. By carefully weeding out incorrect information and helping patients find credible sources, dental professionals can use media as a helpful tool to educate the public and improve their overall health. Sealant programs have also helped to make a huge difference in the oral health care status of students in particular. Wisconsin has a Seal a Smile program, and they've had it for 10 years. It's administered by the Children's Health Alliance of Wisconsin in collaboration with the Wisconsin Department of the Health Services and the Division of Public Health. This program provides many grants ranging from $1,000 to $60,000 to local school-based dental sealant programs that target underserved children, mainly to the schools where the free and reduced lunch rate is greater than 40%. Not only do the students receive sealants, but also fluoride treatments, oral health education, and some preventative services such as prophylaxis and debridement. The number of schools served in the school year 2005 to 2007 increased from 125 to 200, and the number of children who received sealants and fluoride doubled from 3,304 to 7,602. In the 2008-2009 school year, over 16,000 students had access to oral health education. Massachusetts Department of Public Health created a sealant program as well back in 2007. They created this in response to a statewide assessment of the oral health status of high-risk children by providing access to preventative oral care. Training and technical assistance is taught to community partners, and the Office of the Oral Health Providers provides 1 year of supplies such as sealant materials, infection control supplies, and portable dental equipment. Dental hygienists use this portable equipment to provide screenings, dental sealants, and fluoride varnish, and write referrals for treatment and follow-up as needed. These services are provided to all students regardless of their insurance status, and an oral health report card describing the results from the oral screening, services provided, and the urgency of needed treatment with referral information is sent to the student's parents as well as the school nurse. There's a SEAL program also that works with the state's public health hospital dental programs and private providers to see that the students get the care that they need. The hygienist then will follow up with the parents and the school nurse to ensure that the student has received the care. This program has increased the oral health of students in 21 public schools in Massachusetts by providing better access to care and raising the level of knowledge and awareness of dental status for students, parents, and school administration. Several other programs have been developed for sealants and fluoride treatments within the school and community to help benefit and increase the public health's oral health status. In conclusion, several obtainable goals can be set to help achieve better oral health status for the public. Dental services can be made more affordable, whether it be through the use of better insurance policies or by redistributing the roles of dental professionals to help lower the cost of services. Dental professionals can also use the media to their benefit to help educate the population, while our communities can work together to help provide dental care to those with no or limited access. Sheila Vadenbush, PhD, summed it all up by saying, "We cannot drill and fill our way out of the epidemic of dental disease facing the underinsured and uninsured. We can, however, provide positive patient behavioral modification and preventative services to ensure positive oral health outcomes." Thanks.